Very pleased that the Commonwealth Government has indicated their support for Victoria's proposal for an alternative quarantine facility and to fund its construction. There have been very positive discussions with the Commonwealth all the way through, from the PM's comments early on that this was a very comprehensive policy proposal put forward by the state and would be dealt with in good faith, and that has been the nature of the discussions to date. So I'm very, very pleased that today we have reached agreement. Both the PM and I have signed a memorandum of understanding, and we're going to get cracking and deliver this facility. This is a very, very good outcome for Victorians and for all Australians. What we know with hotel quarantine is it's done a very good job, but it is not no risk. It is not a zero risk environment, never has been and never will be. And we've seen right across our nation 21 breaches in hotel quarantine. So our very strong argument has been we must have a Howard Springs-like alternative, a purpose-built quarantine facility for our highest risk individuals, and that's exactly what we will deliver. So we're now going to, as we've already got the expression of interests out, we're already doing the work on the design and planning. We'll work with the Commonwealth. This is a priority for both governments. We'll work with the Commonwealth in terms of if there's any way that we can fast track all of the planning processes. We want to get construction happening as soon as possible. We want to get this open as soon as possible. So I'm very, very pleased that we've reached this agreement today. And I think a lot of Victorians, or most Victorians, Australians will be very, very pleased that we've reached this outcome. The Commonwealth hasn't indicated, and we have not yet landed on exactly which site, but either one will work. Our preference is Mickleham. We are very happy to have it at the Avalon site as well. It will work equally well there, so we are entirely comfortable where it may be. What we can say definitively to all Victorians and all Australians, this will happen. It's been approved by the Commonwealth. They will fund its construction, and I'm very, very pleased at this outcome. Just before questions, the other thing I want to mention is on our vaccine request. Our health ministers, Martin Foley in Victoria, Greg Hunt federally, have been in discussions, and I'm very pleased that the federal government has indicated that it will do all it can to meet the request of Victoria. As we've seen, as we've reported on over the last week or so, we've seen a significant increase in demand for both Pfizer and for AstraZeneca. At our state centres, we're now running at around 140,000 doses per week, but demand still exceeds access, where people are having to wait weeks, where we've seen long queues. We've also seen some gaps in access, particularly in regional Victoria and in our peri-urban areas. So this morning we have made a request to the Commonwealth, a request to double the distribution, double the number of AstraZeneca to our primary caregivers, our GP network. We agree with the AMA that our GPs can do double what they are doing. So we want to see a doubling of the AstraZeneca vaccine to our GPs. We also want to see additional Pfizer allocations, starting from a further 100,000, an additional 100,000 from mid-June, and some confidence in supply for that 6-week period. So we need some ongoing confidence that that supply is coming, and I think the details are being sent around to you. But I want to say again, the discussions between the Victorian Health Minister and the Federal Health Minister have been very positive. The Federal Government has indicated they'll do all they can to ensure that that additional request from Victoria is met. So on those two outcomes, this is a good day in our fight against this virus.